Dear students, welcome to Bluepen Online. Shall we begin? Please use headset, pen and paper to take notes.
Here you go. Please let's know your feedback after class.
Through the Raksha Karma means it's a protective measure. Am I right?
Yes, ma'am.
So, as long as the child remains in the uterus, it is kept at a regular temperature by the body of mother, and it is protected from outside forces, right? So,
Yes,
once the child is born, it has to maintain its temperature by its own regulations, and it should be protected from environmental influences to keep the body at a normal pace. So, to help the neonate to adopt himself, the outside forces, various protective measures should be adopted, essentially, and these measures can be divided into general protective measures as well as the nursing care. Okay.
Yes, ma'am.
So, the PPT which I have fetch person given is the important points, but I'll go through, like, I'll say you I will teach you the whole points, but just the important points I've just mentioned in the PPT. Okay.
Yes, ma'am.
So, so as I said, the protective measures, these measures, they are divided into general protective measures and nursing care. And these measures should be employed during the first 11 days till the naming of ceremony is done. And later on, the child should be nursed and taken care for general line as found necessary. The infant is called newborns when till the age of 4 weeks, right?
Yes, ma'am.
Okay, so when we come to the general protective measures, what and all it includes. So the first thing it includes is the vessel used for pounding rice is inserted obliquely at the threshold of door. So what do we infer from this matter is that this is to it is to protect from the outside world, in the sense it is to protect the child from the other people to enter inside the room, and thereby it's sort of Raksha Karma. Okay.
Yes, ma'am.
So, it is said in 1 second. I'll give you the reference to 13, 14, 15, 16, 17, 18, 19, 20. Okay. Anama karmana dware cha musle dehali manu tirashchinam dehalim anum tirashchinam nyasyat. It is mentioned in Charaga Sharira. Charaga Sharira, 7th chapter. Okay.
Yes, ma'am.
So, in Ashtanga Sangraha, it is mentioned like Dware cha dehalim anutiryen muslam nita payet. So, a pestle is used to pestle used for pounding rice is inserted obliquely at the threshold of the door. Probably it is a sign indicating of labor inside and thus preventing the direct access of the outsiders near to the infant, who is to be guarded and taken care. Thus, the mother and infant should be isolated from other, probably to safeguard from the exterior source of infections. Next is the packets made of Rakshokna Karma. The Rakshokna Dravyas are tied loose at the upper threshold of the door of room in which the mother and the infant live, to the neck of the mother and of the child, to the water pots and other vessels, to the court where the child, mother and the infant sleep, on the either side of the doorway to entrance. So that reference goes like Charaga Sharira itself. I hope. 1 second. It is Charaga Sharira 7th chapter only. Vaja Kushtak Shaumagam Hingu Sarshapatasi Atasi Lashunam Kanang Kaniganam Rakshoknam Samakyatanam Cha Aushadinam Cha Potaligam Batva Sudikagarasya Urtha Dehalya Avasrajet तदा सूतिकायां कण्डे स पुत्रायां स्थाली उदको परिकेष्व तदेवं द्वयो द्वारपक्षयोः सर्वतश्च सूर्यागारं सर्षपादिसि तण्डुलकणकणिगा प्रकीरेयु. That is Vaja, Kushta, Hingu, Sarshapa, Atasi, Lashuna, Kana, Kanigana. These drugs are Rakshokna Dravyas, which is being tied inside a pottery and is kept in the door side. It's hanged in the door side of the room in which the mother and infant stays, to the neck of the mother and of the child, also to the Udaka Kumbhavstali, that is the water pots and other vessels, to the court where the mother and the infant sleeps, and on the either side of the doorway of the entrance. Okay?
Yes, ma'am.
Throughout the rope, Bana in Kadambari is also describes sprinkling of mustard seeds in the house where Vilasavati got delivered. So, in reference says that mustards are sprinkled in the Vilasavati's room while she was getting delivered. Raksha is also called as evil or demon, and the drugs which are capable of killing them, they are called as the Rakshokna Dravyas. Am I right? So,
Yes, ma'am.
What these drugs is that they probably act as an absorbent and disinfectants by killing various organisms. And these includes Vaja, Kushta, Kaushuga, Hingu, Sarshapa, Atasi, Lashuna, and fine particles of various things. Similarly, Adani, Kadhira, Karkandu, Pila, Parushaga are shielded all around inside the room. All these are Rakshokna karmas, and when we see, like, we have a paper regarding the same. Is it visible for you? Is this screen visible for you?
Yes, ma'am. Only slide, ma'am.
Only slide. Okay, fine. So I'll just explain to you. That will be fine. You're not able to see. You're not able to see the paper which I am showing, right?
No, ma'am.
Okay, so I'll just explain to you. It's in a International Journal of Ayurveda Pharmaceutical and Pharmacy and Chemical, I think so. It's about the Raksha Karma in child health care review. It's a review article. So in that they have in their discussion they have mentioned that these Khadira as well as one second, I'll say the Khadira as well as the all these Rakshokna karmas, Rakshokna dravyas, they have tannins as well as deoxy sugars, terpenoids, flavonoids which contribute for the antimicrobial action of all these drugs. Especially Khadira is found to have the antimicrobial activities, especially in the it helps in the non-pathogenic organisms like Bacillus subtilis, Staphylococcus, etc. So what you have to do is you have to correlate why these Rakshokna dravyas, how can this act on as an Rakshokna dravyas? How these dravyas can act as Rakshokna dravyas can be quoted like this, because all these drugs, they have the properties and like antimicrobial, antifungal actions, and also in mustard also it is said that there are antimicrobial actions. So these helps in the Rakshokna action. Okay.